Guys, it's KJ here. Thanks for joining us on this particular gold mail. It's a kind of follow-up to one I did on acne long ago, but today I just want to do a really quick one on Bacne. Now, this is the name often used to describe acne on your back. Now, as I said, we've chatted about acne before, and I think it's pretty good and really easy to understand that if we're looking at the differences between Bacne and acne, they're actually not that different after all. And considering our industry does focus completely on the skin, I wanted to make sure we covered this one off. So the difference between acne and Bacne is, well, not much, except one's on your face and one's on your back. The primary cause of any acne is the overactive sebaceous gland creating too much oil, mixing with the dead skin cells or the cornflakes that then cause a plug over the opening of our pores. If that plug oxidizes, this then causes the plug to go black and therefore will turn into blackheads. If there is bacteria present on the skin or it's transferred to the skin and this then is forced down into those pores where it feeds on all that lovely excess sebum or oil, then the plug occurs. It traps the bacteria that then starts to attack the walls of the shaft. White blood cells rush to the area to counteract the bacteria and damage that is occurring, and it's this reaction of trapped SS oil, bacteria and white blood cells that then create an inflamed pustule or a pimple or something we know as a yellow head. Or the next generation of these pimples is cystic acne, and that's when those surrounding walls actually rupture and leak the contents into the dermal layers, and this then creates further reactions, and as I said, we create large angry cysts, otherwise known as cystic acne at that point. So generally speaking, we know the equation: excess oil plus dead skin cells equals acne, no matter where it is on your body. So if it is the same equation in the getting of the acne, it goes pretty much without saying that it's the same equation to treat the Bacne, same as your face. Rule number one, and by the way, these rules are in no particular order. Anything we use on our bodies, the same as our faces, needs to be water-based and oil-free. The last thing we need if we're susceptible to any kind of acne or Bacne is to add more oil to our skin when it is essentially the oil that is causing the problem. So anything we're using, make sure water-based and oil-free. Rule number two is we need to minimize as much friction as possible from tight-fitting clothes, etc. Because this tight-fitting material against your body will help to push the surface bacteria into your pores, down the shaft, the plug occurs and will create the yellow heads or the pimples. So what we would love to suggest for anyone that's susceptible to Bacne is always to wear loose-fitting clothes. These are an absolute must. And the wearing of any type of backpack is an absolute no-no. There is just way too much friction being created there, and that will really make that problem of Bacne just so much worse. If you're susceptible to Bacne, it's so important to change your bra every day and ensure it is fresh and clean, and that is absolutely every day, again, to minimize the risk of transferring of any bacteria. And also, we know that the average teenager usually likes to live in the same t-shirt every single day for 1,200 days straight. However, if Bacne is an issue, a fresh t-shirt every single day to minimize the bacteria risk. As with facial acne, it's important to be careful when drying. So with your back, soft patting to dry is better than the whole get the towel across the back and wipe backwards and forwards over and over again. You'll only exacerbate the situation. So they're the best practices for minimizing future breakouts. But what is the recommended treatments for Bacne? Now, obviously, it's a little bit hard to reach on your back. We know that topical treatments with things like salicylic and benzoyl peroxide are really good in the treatment of this particular condition. But as the skin on your back is thicker than facial skin, tougher, a topical cream containing salicylic or peroxide also needs to be a little stronger to get through to that acne which is in those deeper levels because the skin is thicker. Now, you can actually get pads that are impregnated with the ingredients, making it a little easier to apply yourself. It's much easier if you have a significant other that can assist you, that can also apply topical treatments consistently. However, it's because of these reasons that often an oral medication is beneficial to treat Bacne. And as we always say, if symptoms persist, always remember to see your family dermatologist. Get a referral from your GP. Remember, these guys are the experts when skin is concerned. So for my money, I would always say that if you have any concern, always go to the expert, always go to the dermatologist. But for now, I wanted to cover off a little bit about Bacne because we are the skin experts, and I hope that this has been a really good part too to your understanding with acne. Well, thanks a lot, guys, and until next time, have a great day, and it's KJ signing off. Bye.